What are steroids? How are they affecting players in sports? Ever wonder how those muscular weightlifters got so muscular? Well, some of them may have gotten their muscle through weightlifting and diet, but others may have gotten it through illegal use of anabolic steroids. Anabolic refers to the steroid's ability to help build muscle.
Steroids are medically used for some forms of amnesia, breast cancer, and other types of swelling disorders. However, there is no use of steroids for cosmetic purposes for athletic performance. Do you think steroids should be allowed in athletics?
I don't believe steroids should be used in athletics. No, not at all.
Okay. Should steroids or hormones be available for anyone to buy?
No, definitely not. There's a lot of effects that can cause harm to you.
Would you classify drug use in athletics to be legal?
Could you repeat that?
Would you classify drug use in athletics to be legal?
No, I would not.
What is the purpose of steroids?
Steroids are to give people edges. It gives you an advantage over your local competition. But steroids can also be used for health problems to help bodies heal and develop in people that have issues within their body system.
If you could control the use of steroids in athletics, would you allow it?
No, I would never allow steroids in athletics.
Does ACHS do drug tests on the
high school
athletic
doesn't
department?
do drug testing on the athletics, and I'm not sure if it's because it's not approved. I'm not exactly sure why they don't do it.
What are the effects of these drugs?
Steroids have a lot of effects. Some of them cause anger issues. Some of them cause like real fast growth in body mass, and it also causes people to go on burnout as well. Get burned out really fast and tired real quick.
Could these drugs cause any health risks?
Yes, they can. Sometimes the anger part of it causes steroids cause the people to become violent and angry and possibly hurt people. Sometimes what it does is your muscles grow so fast and so large that your body doesn't have time to grow with the mass that you're putting on.
Okay, what do you think would happen in football if steroids were allowed into the sport?
If football allowed steroids into the sport, what I believe would happen is you would just have a bunch of big goons out there playing football just trying to kill each other. I mean, as it is now, they're out there trying to, take each other out and win a football game. But if everyone started taking steroids, you would just have like a bunch of Adonises running around the field out there, and that wouldn't be good for anybody.
Okay. What are steroids?
Steroids are a few different types of deals. They have gels, they have creams, they have injections. And what they do is they help you put on a mass to your body. So it increases muscle development, body size, and length. But it can also help eye-hand coordination, muscle reflex, and things like that, which will make you really big and really tough.
Steroids have been classified as controlled substances with severe penalties for the trafficking, possession, or use. But the big question is steroids can cause death, which they can, most commonly by suicide, homicide, liver disease, heart attack, and cancer.
By 1967, anabolic steroid use was widespread among Olympic athletes, particularly among weightlifters, and even though many adamant U.S. physicians saw no benefit in anabolic steroid use. By 1967, anabolic steroid use was widespread among Olympic athletes, particularly among weightlifters, and even though many adamant U.S. physicians saw no benefit in anabolic steroid use and athletic performance. Despite this, International Olympic Council (IOC) banned the use of anabolic steroids, but people took steroids secretly.
We'll have. We've heard a lot of attention on steroids because steroids does enhance performance. Isn't that accurate?
Yes, that's an accurate statement.
but it has very dangerous side effects. And we know that if children use it, it can even cause psychiatric problems as well as other medical problems. There's also a test. So if an athlete is using a steroid, it can be detected in the urine. Human growth hormone, on the other hand, cannot be detected by any test that we know of at the present time. Isn't that accurate?
Yes, at the present time. There's pending stuff working.
People are working on it, but
yeah.
Some athletes believe that if they use human growth hormone, it's going to increase their performance and they won't get caught.
Right.
Are they mistaken? Does it increase their performance?
Well, the reason it has that appeal that way is because you can't detect it, and if you're on like a steroid and you stop it, you're trying to falsely inflate yourself and thinking that you're going to maintain the benefits you've got from the steroids and hopefully make it longer lasting. It may help a little bit in the short term, but that effect, I think, is going to be very short-lived.
Well, that's a short term in conjunction with steroids.
Right, but I'm saying when you taper off, you're going to try to hold on to that benefit, but it's really not going to hold that muscle.
A lot of them are using it instead of steroids. Dr. Rogel, there is this widespread belief that using human growth hormone can increase your muscle mass. Does it make you faster? Does it make you stronger?
Well, this is the second time. That's 2 out of the 3 for the Olympics. Citius, Altius, and Fortius. Higher, stronger, and faster. And the answer is probably not by itself. And so as you look at Sylvester Stallone and say that's a different body for a 61-year-old man, he may very well have been taking growth hormone, Chintropin, that he said he was taking. None of us in this room knows what else he was taking. And I think it's the what else, meaning anabolic steroids, that made the difference. There is, sir, no question that there is a lipolytic, that is fat breakdown effect, and mild anabolic effect. So if you're a bodybuilder and you want that ripped look, that might make sense. But that's about the only place. There are no studies in people who are honest to goodness growth hormone deficient, given growth hormone legitimately, that shows that their strength is very much better, and certainly no performance data, sir.
Usually a hypodermic needle is injected into the muscle to increase strength, but some people abuse steroids by taking pop pills. As part of 2011's NIDA Fund study, teens were asked if they ever tried steroids, even once. Only 1.2% of the 8th graders, 1.4% of the 7th graders, and 1.8% of the 12th graders ever tried steroids, which proves that teens are smart around steroids.